Well, welcome everybody to time-saving research tips for the College of Health and Behavioral Sciences. We're glad that you were able to join us today. If you haven't done so already, please put your name and major or the department that you work in the chat feature. This session today is going to be recorded and made available on Forsyth Library's YouTube channel. So if there's anything that you miss or need to reference later, that will be made available in the next couple of weeks. We also ask that you keep yourself on mute so that you don't disrupt our presenters. But if at any time you have a question, please feel free to use the chat feature and we'll get to you just as soon as possible. And congratulations to all of you for being here today. You are eligible for a prize drawing at the end of the session. So please stick around and we'll announce that winner a little bit later on. So without further ado, I'd like to introduce today's expert librarians and our presenters for today. First is Cindy Lanus, our Instruction and Outreach Librarian. She is a liaison to several departments, and in the College of Health and Behavioral Sciences, she works with Communication Sciences and Disorders and Health and Human Performance. We would also like to welcome Mary Alice Wade. Mary Alice is a research and assessment librarian at Forsyth Library and works with allied health, nursing, psychology, and the social work departments. With that being said, I would now like to turn the program over to Mary Alice Wade.
Hello, everyone. In this session, we're going to talk about how to do an effective search, talk about evidence-based practice, and then have a breakout session where we'll focus on either PsycInfo or CINAHL. And right now, please put your preference for which database you'd like to learn more about, either PsycInfo or CINAHL, in the chat box. And then lastly, we'll talk about where to go for help. So let's say that our research question is, how is COVID-19 affecting people's mental health? Rather than typing all of that into the search box, you wouldn't get very good results. So you want to break it down into the main topics, which would be COVID-19 and mental health. We could choose to use the Search Everything tool, which is the box on the library's homepage. When you search that, it allows you to search across multiple databases on all different topics and gives you a variety of source types, everything from articles to books to newspapers to DVDs. So you're searching a lot of results with a lot of different source types. So for example, if we searched for COVID-19 and mental health, with mental health in quotes, so it'll search it as a phrase rather than the individual words, in the Search Everything tool, we get over 44,000 results, and it's a combination of newspaper articles, magazines, peer-reviewed journal articles, books, videos, dissertations, etc. So that would be a lot to sort through. And there are ways to limit that search, but normally for upper level research, we especially recommend that you go in and search one of our databases directly. Because when you go there, you're searching a smaller pool, but a more focused pool of results. And some databases focus in on a particular discipline and source type. For example, PsycInfo has peer-reviewed content on psychology and related disciplines. So to find a database to search, you want to click on Research Databases on the library homepage to choose a database. What you see next is the alphabetical list of all of our databases. We have over 200. So how do you know at that point what's best for your topic? Well, you can go up to the top at the subject menu and select your discipline or the most relevant topic, like psychology or nursing or whatever. And then you'll see a much shorter list the best databases for that topic. So I'm going to choose PsycInfo because it is the major database for psychology research. It has almost 2,500 journals, and 99% of those are peer-reviewed. It goes clear back to 1597 up to the present. It has nearly 5 million entries in it. So it's a really good, solid place to do psychology research. We have our COVID-19 and mental health, but we can also add additional Boolean operators and or not to further focus our search. If we're getting too many results, we can add keywords with and. So and equals fewer results. If we didn't get enough, we could add synonyms for some of our terms connected with or to broaden your search. So that way you get all the relevant articles that, even if they happen to use a slightly different term for your topic. So just remember or equals more. Or if you're getting irrelevant terms, you can add not to exclude a term. So for example, in PsycInfo, if we search for COVID-19 and mental health in quotes, it yields 837 results. Now, normally, if you add 837 results, you're going to want to start narrowing down, not making it bigger, but just for the sake of an example. When we put in additional terms for COVID-19 connected with or, it increases our results to 1,355. So it can make a real difference if you're not finding enough. If we wanted to exclude a term, we could use not. For example, MERS. MERS is also a coronavirus, but it's not the one we're interested in. So I can exclude it with not MERS. And that eliminated 14 articles out of our pool. All databases also have filters that allow you to focus your search. Just about all of them have a full text limit, which means all your results will have a link to the complete article. Peer reviewed, so that your results are scholarly articles that have been vetted for quality by other scholars in the field. That's the most common source type that's required for college level research. You can also do by date, by subject, and there may be a lot more. Some databases offer a wide range of filters that is tailored to the kind of content it is. So when we focus our PsycInfo search with full text and pub date of 2020, our pool of results goes down to 175. And as I mentioned earlier, we could add additional keywords such as and United States to keep focusing our search and get it down to a manageable amount of hits. So just to recap, for a good search, you want to first make sure you're looking in the right place. So choose a database that has content that's relevant to your topic by going to research databases and then using the subject menu. You don't want to type your whole research question in. You want to break it down into keywords and then craft a strategy using and or not. And finally, use the filters that are available to further focus your search so it really targets your topic and the kind of source that you need. Thank you.
All right, so I'm going to talk a little bit about evidence-based practice. So here in the College of Health and Behavioral Sciences and even beyond that, we're often told to practice evidence-based practice, and a lot of our research assignments may be based around that concept. So just to make sure we are all kind of talking about the same thing, when we talk about evidence-based practice, that's really talking about using a combination of clinical expertise mixed with the best and most current research evidence that's out there. And then you combine that also with your patient's values and preferences that you're working with, and that becomes what we call evidence-based practice. So in some ways, it's kind of that three-legged stool of without the clinical expertise or without the evidence of the best and most current evidence out there, or without our patient involved, we can't really get to that end solution of providing that evidence-based practice. And it's definitely a prominent thing that we talk about in healthcare and the health-related fields. There's been a trend from kind of what were just traditional solutions of, well, we've always kind of done it this way, to then adopting this evidence-based practice of, well, what does the research actually say, and how can we continue learning and developing and potentially even challenging some of the more traditional treatments that we've always used with our patients. So an example of this that I know, with me being the liaison to HHP, for example, there are some people out there that have started producing clinical trials and systematic reviews that challenge that RICE, that rest, ice, compression, and elevate when you have an injury, and are starting to challenge that traditional treatment and saying, perhaps heat therapy. We're seeing more clinical trials out there. We're seeing more things that show that heat might be better for injuries than ice. So that's just an example of kind of how evidence-based practice can fit into our more current understanding and more current clinical expertise, and really treating our patients with the best care possible. And where the library fits into this evidence-based practice is one of those three legs of the stool is that current and best evidence that is out there. And here at Forsyth Library, we provide, as Mary Alice mentioned, hundreds of research databases and all of these different search tools and search tips and research help to help you identify and locate and access that current and best evidence that's out there in your field, so that you can then make those decisions about care. So then when we think about evidence and evidence-based practice, we need to kind of think a little bit more about the different types of evidence that are out there. And so this pyramid here, starting at the top, is kind of our most appraised or most evaluated and filtered type of evidence that's out there. We have our clinical practice guidelines of kind of those accepted treatments or methods and approaches to things. Next at the top, we have our meta-analysis and systematic reviews. And those are very appraised as well in terms of they collect and gather all these different types of clinical trials, controlled trials, different other types of evidence, and combine them into one systematic review or one meta-analysis to really combine all of those studies together to show the efficacy of a treatment or of a particular type of care. Sometimes people get systematic reviews confused with a literature review, and those are very different things. A systematic review is kind of that all-encompassing. They are working on finding all the different trials that are out there, combining those together to say, this is what we know as the best treatment method. There is a little caution about this level of systematic review and meta-analysis, because if you think about even just some of the research projects that we have where we need to find like 5 sources or something like that, that can sometimes feel overwhelming. But when someone is writing a systematic review, it is their responsibility to look under every stone and pebble to find all of the research that's out there, all of the trials that are out there, to combine them into one. So there's definitely a little bit of bias, or there can be some bias of, are they only looking at English studies, or are they only, a lot of times systematic reviews may only consider the new types of treatments versus doing some type of review about a traditional or more standard adopted treatment. So those are just a few things to be aware of when we're finding systematic reviews, is just to kind of read through their methods, how they found all of their studies, and what they're looking for. Then below that, we saw different types of trials and different things that are out there as well. But between the systematic review and a meta-analysis, which kind of adds an additional statistical analysis element to that, finding all of the trials. Those are oftentimes what we're looking for when we're looking for evidence. And sometimes we'll have to go down that hierarchy, which I'll bring up here again. So then when we think of different types of evidence, and then we think of asking some type of clinical question, because we're wanting to find evidence to help answer our clinical question for evidence-based practice. We're often forming our questions around PICO, which stands for patient and intervention, control or comparison, and an outcome. And sometimes there's a T at the end to factor in an element of time or a duration of time as well. And in order to develop a good PICO question, we need to have a pretty good understanding of our topic. So maybe even before we get to that point of developing our question, we would need to do some background research with our textbook, or just some reference material, encyclopedia entries, or just get a little bit of a better understanding of what it is that we're working with. So to give an example of PICO, perhaps I would apply my PICO question and start asking about, can birth support or doulas reduce the rates of complications and C-sections among laboring women? So if I break that down to my PICO, I have my patient of women in labor, my intervention of the birth support or the doula role, my control as being just normal care versus having a doula, and then my outcome being different rates of complications or C-sections. And sometimes if we need to turn our PICO question into an actual research question or thesis statement when we're doing research projects, sometimes it gets a little, we kind of take a minute or two of like, well, how do I phrase that then as like a sentence, a research question? So if we apply among to our P of PICO, does to the intervention versus to the control, effect to the outcome, and during, that might help us kind of convert our PICO question into more of like a thesis statement type research question as we get down the line too. So maybe my PICO question becomes, among laboring women, does birth support versus normal care affect complication rates during the birth process? Because sometimes when I'm working with students on PICO questions and research, we have our PICO outlined, but then in order to really communicate what the topic is about, what we're comparing, those words in red kind of help apply with our PICO. So then circling all the way around with evidence-based practice, once we have our question, our clinical question, we can identify what type of question we have, which would be this column over here. Most likely in the health sciences, we're looking at either some type of therapy or treatment or prevention. And then the different types of evidence that are kind of in priority order from left to right here on this table would be listed here. So if we are doing a prognosis or outcome or diagnosis type question, we would look at those areas too. But in both the therapy and prevention, which are most common types of questions, systematic reviews and meta-analysis are kind of those are great to find. Otherwise, randomized controlled trials are oftentimes a type of evidence we're looking for. And then we kind of move further down that pyramid or hierarchy that we saw before of, if we can't find systematic reviews or randomized controlled trials, then we move down further to different cohort studies and other types of studies, down to individual case reports. That might help us with finding our evidence with evidence-based practice as well. And then for some tips for finding our different types of evidence, we want to actually use those types of evidence as keywords within our searches. So if we're looking for a systematic review on doulas, or if we're looking for a systematic review on the best treatment for plantar fasciitis, we would want to add systematic review as a keyword and connect it with our topic of plantar fasciitis. Just as Mary Alice is talking about connecting those keywords to get more results and get the results that we're actually looking for. Here at the library, a lot of our databases will actually have article type or publication type filters where we can select specifically, I want a clinical trial, or I want a meta-analysis, or I want a systematic review. Sometimes those are found in the advanced search settings, where other times they're found in like the sidebar filters. It truly kind of depends on the database. And then we do have two specific databases. One of them is called Cochrane Library, which is a well-renowned systematic review database, and they literally have a process for creating these systematic reviews. But they also house clinical trials in their in the database and in the settings. There's literally tabs across the top of, do you want a systematic review on your topic or a clinical trial, and break it down from there. We see similar type of labeling in more of a HHP type database that's called Pedro that we have on our research databases list as well. And they really break it down and label what is a clinical trial, what type of evidence is it. And once we find results, how do we know what type of evidence it is? Oftentimes it's in the title. If it's not in the title, it should be in the abstract. If it's not in the title or the abstract, I'd maybe start questioning if you found the right type of evidence. But also thinking about where you found it, like using Cochrane Library or Pedro, might give you clues along the way as you're searching too, as to what type and what level of evidence you're working with. Any questions there before we go to breakout rooms? All right, so we'll have 2 breakout rooms, and I'll let Brittany take over here.
Yes, thank you. I have assigned everybody to the breakout rooms that you indicated in the chat. If you didn't tell me, go ahead and put that in there, and I'll get you assigned to a breakout session here before we launch. Just a couple of quick notes that you will be in your breakout sessions for 10 minutes. And once the breakout rooms have launched, you will not be able to change rooms at that time. So we ask that you stay in that breakout room with your librarian. And then at the end, everybody will be invited back to the main room for just a few wrap-up kinds of announcements. So with that being said, you will all shortly receive an invitation to join your rooms. And so I invite you to do that now.
Right, so we'll get started with this breakout room about CINAHL. As a brief overview of what it is, CINAHL might seem like an interesting name, but it stands for the Cumulative Index to Nursing and Allied Health Literature. So it will include literature and articles and different types of evidence that we talked about earlier. And because it is an index, a lot of the results may be citations and may not always take us to the full text within this database, but we'll talk a little bit more about what we see and how we can get to the full text of the results that we're finding within CINAHL. So if we're in any of those allied health, nursing, health-related majors, we will either get to CINAHL by utilizing this research databases button on the library homepage, or CINAHL is likely listed in several of our subject and course guides, depending on what your major is and where you are focusing on. So I'm going to jump over to the library homepage, and we're going to go just directly to research databases. So because I know it's under the communication sciences and disorders, I will select that, but it's also under nursing and HHP and several of the other majors within this college. And CINAHL is a pretty great resource, so we do oftentimes highlight it as a best bet. Otherwise, it may be listed below whatever your subject area is as well. Or I can always find it just by clicking on C on the A to Z list, but I may have to do a little bit more scrolling. So CINAHL defaults to an advanced search, and some tips for advanced searching is it's often tempting to plug in too many details, check a little too many boxes, because especially this CINAHL advanced search, it's pretty extensive and pretty detailed about what you can define within your search query and what you want to get back with your results. So I'd recommend just adding 1 or 2 keywords and then checking 1 or 2 boxes within the advanced search and see what you get, because searching is always that iterative process where you're kind of seeing how many results you get, whether they're relevant, and coming back to the search, adding more keywords or taking some away. I mentioned we want to just start with a few boxes of checking those boxes with the advanced search and a few keywords, because otherwise if we add too many, we'll get no results. So I'm going to say I'm doing some research on concussions, and you'll notice this database is talking back to me and kind of suggesting some other terms. I'm not going to accept any today, but that's always a good thing to kind of pay attention to with this database. So I'm curious about the reporting behavior of concussions. And when I'm scrolling down to this advanced search, this publication type area here will actually, we start seeing the different types of evidence we were talking about in the bigger session, such as case study, clinical trial. So I'm going to shoot for that top tier and see what I can get, if there's any meta-analysis or any systematic reviews about my topic. And I can hold down the control button to select multiple publication types from this list. And then I can click search. And by selecting those publication types, I'm literally saying I want these types of evidence only. So my results are probably going to be pretty narrow, because once there's a systematic review about a topic, it's not super common to have hundreds of systematic reviews all about the same thing. So it's pretty specific already, down to 3 results. And as I mentioned, this is an indexing. It's mainly an index of results here. So we see a few that have the full text PDF. This top one looks like that has the immediate access to my article. But these other 2 list Find It at Forsyth. So I'm going to show you each of those and kind of what we would do in those instances. So I know it's a systematic review because it's written in the title. I can read the abstract, get a little more information about it. Oftentimes the systematic reviews, they'll tell you their methods of how many articles they're actually combining together within that abstract. EBSCO databases have these standard toolbars on the side. So that will help me save this article to my drive or email it to myself if I'm not using a citation management tool. They do have a citation generation tool within EBSCO, but I would caution against just blindly copying and pasting this and adding that to your reference list, because there's almost always something wrong with it. For example, this title shouldn't be capitalized with every single word. But it can give you a start and give you, make sure you have the information you need to get back to this page or to this article if you need to. I also want to point out the permalink, which is a tool that will always get us back to this page. As long as we have that Fort Hays affiliation, this will get us back into this database, back to this page. If I was to just copy and paste this link up here, I'd get a dead end because that is unique to each search and each search session. So you'd want to look for that permalink, or you'd want to look for a DOI, which would be listed down here. A DOI is a digital object identifier, and that number is a unique number that will always get us back to this article's detail page. No matter where it lives in what database or whatever, that's kind of a unique address that will help point us to where we can find this information again. And that's actually a part of the last part of a APA citation. So we'd want to find that DOI anyways when we're citing. So this was our example that had the PDF full text right there. So if we clicked on that, we'd get our actual report that we could download of our systematic review. And we could just read it right here, download it, share it, do whatever we need to do. If we go back to our results list, I want to show you what that Find It at Forsyth actually means. So I'd probably want to click the title, read the abstract, make sure I'd want to actually access this article. And when I click the Find It at Forsyth, that kicks me over to the library catalog. And then that catalog will point me to any other database where this article actually lives in that full text PDF. So in this instance, it's in the nursing and allied health ProQuest database. And we see my PDF, which is right here. So what Find It at Forsyth does within EBSCO is that it kicks you over to the catalog to tell you if we have that article, where it lives, to get you to where you need to be. Occasionally we get to this page and it says no full text available. But you'll notice there's a link that says not available, request from interlibrary loan. If I clicked that not available, request through interlibrary loan, if I have an account, I can log right in. If I'm a first-time user, I'd want to click that button there. And when I log in to interlibrary loan, it will auto-generate my form for me to have interlibrary loan department reach out to any other library to get that access and email that article. So this is a free service for you, and most times it takes about 2 to 5 days for us to find that article and deliver it back to you. In my experience, it's been closer to that just couple day turnaround time. So if it's due the night before, don't rely on interlibrary loan getting that article for you overnight. So it is something where you need to research and plan ahead, but if you're going right from the catalog, it will autofill this information. Otherwise, you can get to that page from the library homepage and clicking on services and interlibrary loan. And in that instance, if you're just logging in from this page, this is also where you can create an account if you don't have one yet. But if you logged in, then you would just copy and paste the title, the article, title, what authors, what year it was published, etc. And then we'll get that for you. Back to CINAHL, the last thing I wanted to point out were these subject headings. So EBSCO databases basically tell you we're organizing all of these articles into filing folders. Think of a massive filing cabinet with millions of articles. So if I were to click on one of these subject headings, that will launch me to a new search. So I'd have to add my systematic review or meta-analysis in again. And this time I could either do it as keywords or do it later down the line. But so I might want to do brain concussion and just systematic review. What else is out there? Maybe not just about the reporting behavior. And so that will be another way to search, where we're actually like going to that file folder, searching within that subject area, and then adding some keywords added on to the top. Since this is everything about brain concussions, I'd still probably want to be a little bit specific. Maybe I'd just try report instead of reporting behavior and see what was I missing by being super specific. So those are a few advanced search strategies and a little details about CINAHL. We'll be going back to our main room, so I will see you guys all there. If you have any questions about CINAHL or about your research, we're happy to help, and Brittany will be talking about that in just a little bit.
Hi, I'd like to talk to you more about PsycInfo in a little more depth. So for these examples, I'm going to choose to search about anxiety in college students. At this point, I'm not sure exactly what aspect of this topic I want to research, so I'm just starting with a simple keyword search. You'll notice that there are synonyms connected with OR for college students, and in EBSCOhost databases, if you start typing a term and then put OR, it will suggest terms for you. So I've chosen college students or university students or undergraduates. When you get some results, you'll notice that some have a link to the full article right there. It'll say PDF or HTML, and others have this Find It at Forsyth link. What this does is look in our other databases for this article, because it's not in PsycInfo. If it says full text available, it'll give you a link to the database that has it, in this case, ScienceDirect, and clicking that will take you to the article. If no full text is available, right underneath there'll be this link, request from interlibrary loan. And what that means is you are asking us to see if we can locate this article for you in another library. So the first thing you have to do if you've never used this before is create an account in ILLiad, which is our interlibrary loan system. Log in and then just fill out the online forms and submit it. For articles, it usually just takes a few days. Things like books or DVDs that have to be mailed will take longer. And that is a free service. Next thing that you need to know are about subject terms. These are really helpful when you're doing a search. What they are is the way that this particular database describes certain topics. They tell you two things. They're always located right under the citation, under an article. They tell you these are the main topics of this article. And secondly, it can tell you this is the way that this particular concept is worded in PsycInfo. Different databases can describe the same topic in slightly different language. So it's worth finding out what this database is calling your topic. So if you do a search for subjects, you know that the articles you find are going to focus on those topics rather than just when a keyword search, it might just mention your keywords here and there and not really be about your topic. And you can find subject headings by browsing articles, as I was just doing, or by searching for a term in the thesaurus, which in PsycInfo is linked just above the search boxes. So I did a search for social distancing and found out that the proper term is physical distancing. And that's not something I would have guessed without looking it up. So when I was looking at my results, when I searched for social distancing, I noticed they went clear back to 1970. So from 1970, before 2020, basically, or 2019, social distancing meant something different than it does the way we're using it during the pandemic. It meant more of a reluctance to interact socially with a particular person or group. So you can see how physical distancing actually is a better descriptor of what we mean by social distancing today. Another way that you can control your search is by what field you tell the computer to look for your terms in. It defaults to the selective field, which will look everywhere in the record for your terms. So that gives you lots of results, but also lots of results where maybe your term is only mentioned. You can choose subjects, as we were just discussing. You can also look in like the title or the abstract. If your term appears in the title or the summary of the article, you know that it's a main topic of the article. So that's another way to find things that are focused on your topic. And PsycInfo has a long list of fields that you can choose, including one called tests and measures, which I'll talk about in just a minute. So tests and measures, if you need to find some scales or tests to measure a concept or behavior in some kind of an experiment that you are proposing or getting ready to do, it can be hard to identify what are the best scales or what are some scales that exist about this topic. So if you click on the title of an article that's relevant to what you're interested in and scroll down to the tests and measures field, it will tell you all of the scales that were used in this particular study. If it's got a DOI after it, you can go to doi.org and search for the DOI and you can find a description of the test. If you're looking for the actual test itself, which are not usually included in published journal articles because the tests are copyrighted and they want to protect the integrity of the test, but once in a while they are. So you can do that, search for that by including the word appended in your search and choosing tests and measures field. That way it will bring up any articles that have tests on that topic actually included in the article, usually at the end in the appendix. Or you can also search for a particular test with the word appended to see if there's any articles that contain it. There are many filters that are available on the left side of the results page. You see the typical ones like full text and by date, etc. But if you go down further, you'll find other ones such as publication, which means the journal, language, age, gender, methodology, etc. So these are useful in many ways. Perhaps when you're looking through your results, you notice that one particular journal has a lot of relevant articles. So if you want to see everything in your results group that's from that journal, you can limit by publication. By language, maybe you want subjects, art studies that were done on subjects of a particular age range or gender. And then methodology, maybe you're looking for a qualitative study rather than quantitative, or longitudinal, or the various different methodologies. You can easily limit to those using these filters on the side. I wanted to now show you some tools that are available in PsycInfo. This one is one that I use a lot. Once you've done your search, right above your top result is this share button, and you click that and you can get a permalink to this search. So this will take you back to your search and all of your results. So it'll show you how you searched and then give you the complete pool of results that you found. So it's really nice as a way to just easily keep track of things. And also if you need to share things between group members, things like that. Some other tools that are included, if you click on an article title, you'll see over here on the right, there's a list of different tools, including email, cite, permalink. So the citation feature, if you click cite, it will offer the citation for the article you're looking at in several different styles. So you want to make sure you're looking at APA, and it will give you the citation. You do want to be careful and always check the accuracy with your manual, or if you're using an online guide, because sometimes they do have mistakes. The permalink is down here. This will give you an unchanging link to take you right back to this specific article. You don't want to use the information that's in your browser's address bar, because that will not take you back to the article. So be sure to use the permalink if you want to keep a link to the article. In any EBSCOhost database, there's a folder system. You can sign in, create an EBSCOhost account, and you can keep articles in a folder that will remain there after you close out of the search. And lastly, I want to tell you about the Psychology Research Guide, which you can find with this link, or on the home page, click Subject and Course Guides and look for Psychology. And on that guide, there is a page called Using PsycInfo, and there are several tutorials there that reiterate some of what I've talked to you about, and some other topics as well as how to use PsycInfo, including how to use the EBSCOhost folder system. Be sure to let me know if you have any questions about using PsycInfo. I'd be happy to help you.
Welcome back from the breakout sessions to our main room today. I hope that you enjoyed your breakout sessions and were able to get some key time-saving research tips. To wrap up today's session, I would like to talk to you for just a few minutes about where you can go for additional help. You can ask a librarian for help at any stage of the research process through any of these channels: by phone, text, email, by making an appointment, or using the chat feature on the library's website. You can also reach out directly to your librarian liaison, and you have been introduced to those two today, so their information is included on the screen for your reference. Another way that you can contact the library is through our new Research Help app. So if you would all take a moment to pull out your mobile device, and you can either scan or take a photo of the QR code on the screen, you will be prompted with instructions to install our new app on your phone. Once you've done that, you'll have access to the Ask a Librarian service. You'll also see tutorials to help you navigate library resources, as well as research guides that are specific to your major and different areas of study. That brings us to a close for today's session, but if any of you have any questions or concerns, please feel free to put those in the chat, or you can stick around for a few moments after, and I'm sure our librarians will be available to assist you. Thank you so much again for joining us today. We hope you all have a great rest of the week.